Thank you for the great introduction, Dr. Crownover. Hello, everybody. My name is Reese Phillips. I'm the owner of Preferred Senior Benefits. We're an independent Medicare advisory firm based here in Boise, Idaho. And I'm going to go over some basic information for Dr. Crownover's clients in regards to how general Medicare works. Now, I need to see a couple things that we have to for legal reasons. First and foremost, I do not work for the government. I own Preferred Senior Benefits, which is an independent Medicare advisory firm based here in Boise. And I'm just going to be going over some of the general ideas of how basic Medicare works. With that being said, let's go ahead and jump into it. I'm going to go ahead and go to the front page of the Medicare and You book. So this book is something you get when you first sign up for Medicare, and then you also get it every single year after that. And for the purposes of our conversation, I'm going to go ahead and jump to page 5, and this is going to go over the basics of Medicare. And I really want to give you a general idea how your two primary options work and how they are correlated with Dr. Crownover's service. So first thing we're going to jump into is how Medicare Part A and Part B work. That's the part you get from the government. If you want to take a look at what the card looks like, this is what that card looks like. If you're on Social Security when you turn 65, they usually will automatically mail that to you. If you're not drawing Social Security when you turn 65, you have to sign up for that, okay? So let's jump into the parts of Medicare and how it works. So first and foremost, there's two primary options when it comes to Medicare. There's going with original Medicare, and there's pluses and negatives to that. And then there's also going with Medicare Advantage, and there's pluses and negatives to that. You can only be on one option or the other. So let's talk about each one of them and what the pluses and negatives are. So first and foremost, if you go down the original Medicare path, you're going to have Medicare Part A and Medicare Part B from the government. For all intents and purposes, that covers about 80% of your hospital and medical costs. Okay. Then you have an option of buying what's called a Medicare Part D plan, which is D as in drugs, to cover your drug coverage. So it helps you pay for your drugs, things of that nature. The other option you have is to buy a Medicare supplement policy, also known as a Medigap policy. All that simply does is that fills in the gap that Medicare A and Medicare B does not pay for. Because if you're just on original Medicare, there's no max out-of-pocket coverage, meaning if the bill's $100, Medicare pays $80, you pay $20, no big deal. If the bill's $1 million, Medicare will pay $800,000, which is great, but then you could potentially be responsible for up to $200,000. So that's something to be aware of, okay? The great thing about original Medicare or option 1 is there's no networks. As long as the doctor's office takes Medicare, which is about 97% of doctors as of 2022, you're going to be accepted and you're good to go. The negative side about this option is that it's relatively expensive compared to option 2. A lot of clients who go on this really like the fixed payment model, meaning they pay the same every single month, and other than their drug costs, it's relatively stable. Or it's somebody who really understands that they have a chronic issue and will be going to the doctors a lot, specialists a lot, the ER, things of that nature. So that's option 1, that's original Medicare. And for Part A and Part B, no matter which route you go, whether it's original Medicare or Medicare Advantage, you have to have Part A and Part B to be on those plans. As of right now, Medicare Part B starts at $170.10 a month as of 2022. And for most people, Medicare Part A, there is no monthly premium. So you'd be looking at paying a premium for Part A and Part B. That's one insurance. You'd also be paying a monthly premium for Part D. That's a separate insurance that you buy from a for-profit insurance company. And then you'd also be looking at buying supplemental coverage or Medigap policy from another insurance company. So hypothetically speaking, you would have 1, 2, 3 insurances. Now, if you also wanted dental, vision, and hearing, you'd have to buy those separately as well. So you could imagine adding 1, 2, or 3 other insurances to this group. But this is a great plan. We kind of consider this the Cadillac option. But it really is great, and it does cover a lot. However, on the downside, it is relatively expensive. Okay, so that's option 1, and that's the pluses and negatives of option 1. Option 2 is a Medicare Advantage plan, also known as Medicare Part C. So once again, to get Medicare Part C, you have to have Part A and Part B. And then most Medicare Part C plans are going to have a Part D plan built into it, a drug plan built into it. Plus, most of them are going to come with additional benefits. Dental, vision, and hearing being some of those benefits. Some plans also come with a gym membership and quarterly money back to buy vitamins, lotions, things of that nature. Okay. The Medicare Part C plans are very similar to group plans that you're used to having when you were under 65 or when you worked for somebody. They're going to have a max out of pocket. They're going to be small percentages you pay every time you go see a doctor, you go to a specialist, things of that nature. But they're very, very similar. So let's talk about the pluses and negatives to the Medicare Advantage plan. The biggest negative to a Medicare Advantage plan usually is that they're going to have to fall within the network to make sure you get the best coverage. And some of your providers, some of your specialists may not be in network. So that's why figuring out what the network looks like and if your doctors are in network is so important. Those networks can include an HMO, PPO, or fee-for-service type of network. That's probably the biggest negative when it comes to these plans. Another potential negative to this plan is you're going to have a max out of pocket. So every time you use it, majority of the time you're going to have to pay a small percentage when you go see a doctor or a specialist. Now, the great thing about these plans, unlike original Medicare, is most of the plans do have a MOOP or max out of pocket. So in a given year, you're going to spend X, whether that's, $5,000, $10,000, the numbers range, but you're going to have a set dollar amount. Okay. One of the biggest pluses about these Medicare Advantage plans is the majority of the plans are relatively inexpensive or free from a monthly premium perspective, above and beyond what you have to pay for Medicare Part A. Okay. Another big benefit of these plans is they do come with those ancillary services, dental, vision, hearing, gym membership, things of that nature. And they're also, all of these things are usually included into one insurance, so you'd only have one insurance to deal with. Now, when you go with Medicare Advantage, Medicare Part A and Part B are no longer managed by the federal government. They're going to be managed by that for-profit insurance company. So this is just designed to be a quick overview of original Medicare, Part A and Part B, and how your two primary options work in correlation with that. Now, I'll tell you this. You have a 7-month original election period when you first turn 65, 3 months before you turn 65, the month you turn 65, and 3 months after to make that initial election period, or that initial election choice. If you're going to do that, the only time you're guaranteed to get a Medicare supplement policy, which is option 1, is right when your Medicare Part B goes into effect, or that initial enrollment period when you turn 65. So if you're going to go down that route, that's probably the best time for you to do it, knowing that you'll guaranteed to get actual access to that plan. Medicare Part C, you can always qualify for in most cases. So this has just been a real quick overview for Dr. Crownover's patients. Hopefully it answered some basic questions. We are one of Dr. Crownover's preferred vendors, so he'll give you our information or another great broker here in the area, and we'll be able to help you out. If you have any questions, ask Dr. Crownover, or feel free to reach out to us directly. Thank you so much for your time. Thank you for being a patient of Dr. Crownover's. Have a great day. Bye.